Next, I'd like to invite to the stage Gita Sharkey, who has worked in children's services for over 12 years, but is currently team leader of the Rights and Participation team in Scottish Government, which covers policy on disabled children, youth work and children's rights. And so she's going to come on stage to give us an introduction to policy from the perspective of disabled children and their families. So thanks very much, Gita.
I'll share with you a comment from one of my colleagues. She said, "Gita, you'll be fine. Everyone expects Scottish Government to be boring." So here I go. So I'm Gita Sharkey and I work in the Rights and Participation team. When I was invited to speak today about personalisation, learning from experience and evidence-based practice, I was delighted, as all are key to getting it right for every child, our approach for all children and young people's services. So today I'll introduce the context in which I work, discuss the key aspects of GARFEC approach and how they link to short breaks, say a bit on the main provisions of the Children and Young People Scotland Bill, particularly in relation to GARFEC, and then look at how you might be involved. Some of you might be quite familiar with the areas covered in my presentation, others might not, but I hope that you'll get something useful out of it. So this slide shows the Better Life Chances unit in the Children's Rights and Wellbeing Division. My small team, Rights and Participation, which is right there on the left, covers 3 policy areas: disability, children's rights and youth work. All are linked by issues around children and young people's rights and children and young people's participation in policy making and in decisions that affect their lives. And of course, they're all connected by the GARFEC approach. One aspect of my team's role is to work with the GARFEC implementation team to ensure that all 3 policy areas are integrated with GARFEC. Carol Rice leads on disability. Some of you may know Carol as she's seconded from Edinburgh Council, and she's here today. Give us a wave. She doesn't work alone. She works with colleagues in children and families and with others in Scottish Government who lead on policies that can affect disabled children and young people. For example, on equalities, short breaks and self-directed support, additional support for learning, transitions and the Doran Review, amongst others. Ministers say we want Scotland to be the best place in the world for children to grow up. Very ambitious, but why not? We all want the best for our children and young people. This slide shows our aspirations for children's and related adult services which sit beneath. Providing short breaks for children and young people and for their families delivers on so many of these. Short breaks are essential to many families in helping to deliver the best place to grow up. So how do we deliver a policy that embraces this? For GARFEC, a 3-year development pathfinder in Highland and other activities involving children and families led to the development of principles and values, core components, a national practice model, and a range of practice guidance. I'll go back to the principles and values in a minute. First, a brief bit of history, an explanation of why we've adopted this approach. Too many child death and child abuse investigations highlighted that key information was known but not shared. No one person was aware of all the facts. Children were either falling between the gaps in services or were not getting a service until a threshold of need had been crossed. The past experience of children and families has been one of frequent repetition of facts and details and attending numerous meetings, often with the same professional at the other side of the table. I'm sure that some of you here today can relate to that. The challenge was how to change that. This slide shows key reports and legislation which led to the development of GARFEC. So what is GARFEC? Good question. It's a personalised approach to children and young people, whatever their background, whatever their needs, whatever the risks and whatever the circumstances. It has the aspirational aim of improving the life chances for every child. The GIRFEC principles and values developed during the Highland Pathfinder have stood the test of time, and rightly so. And half of them are up there, and they continue. The synergy between the principles and values and what sits behind the planning and delivery of successful short breaks for children, young people and their families is clear to see. Short breaks are all about promoting the well-being of the child and that of the wider family. Tailoring breaks around the needs of the child, service providers must work in partnership with other professionals, but crucially, also with families who will, after all, know their child better than anyone and what might be best for them. Each break will, of course, be unique. This is the central concept of GIRFEC, the vision of the child at the centre. If you start at the centre and move outward, the help provided is more targeted, more specialist, and ultimately ends with compulsory measures. Short breaks, I think, would probably fall somewhere in the middle. We build from the needs of the child, drawing on the family and those closest to the child as necessary, to build a strong network of support. In GIRFEC, there are no thresholds. Depending on need, action should be taken, and that action might be a short break, which might be all that's required to stop the level of need escalating outwards. The child is placed at the centre of decision-making, and their views are sought and listened to wherever appropriate. GIRFEC applies to all children, including disabled children and young people, and it also applies to those working with adults who are parents or carers. And it's based on evidence of what works. Other key elements are having a named person for every child, a contact for the child and family and the first point of contact for any concerns, a lead professional where more than one agency is involved and delivering a service, and a national practice model built around well-being. GIRFEC promotes a shared language and common understanding using well-being as the basis. This concept of well-being emerged from the pilot studies. To have a chance of fulfilling their potential, each child must be doing as well as possible in each of the segments. The segments represent Shinari: safe, health, achieving, nurtured, active, respected, responsible, and included. This is child-specific. A disabled child, for example, may never be as active as a majority of children, but equally, they may not currently be as active as they could be. A child with additional support needs for learning may not reach the academic attainment of other children, but they may be able to progress on achievement, and so on. The Wellbeing Wheel is a way of bringing together information and concerns about a child and deciding where action may be needed to improve the child's circumstances. It's the intention of Scottish Government that the Wellbeing Wheel will become the overarching framework for all work with children, young people and their families. And I know that Shinari principles are at the very heart of what makes a successful short break. You might be familiar with the My World Triangle, an assessment tool that places the child at the very centre. It provides a framework for practitioners to consider the whole child and the factors that might be affecting their life. The short breaks experience will contribute to the triangle. It's a simple tool to use, but most importantly, it's very user-friendly and easy for children and families to understand. Together, the Wellbeing Wheel and the My World Triangle form the core of the national practice model. So, across Scotland, real progress has been made in terms of implementation of GIRFEC, although there's still lots to do. The provisions contained within the Children and Young People Bill should help with this. So on the 4th of July last year, the Scottish Government launched A Scotland for Children, a consultation on a Children and Young People Bill. The consultation ran for 12 weeks and closed on the 4th of September last year. After ministers had considered feedback from the consultation and from extensive stakeholder engagement, the Scottish Government response to the consultation was published, and the bill and accompanying documents were introduced into the Parliament on the 17th of April this year. The bill contains a range of provisions on a number of different aspects of children's services, So I'll cover those most closely linked to the implementation of GIRFIC, and which might have an effect on the importance placed on the provision of well-managed short breaks for disabled children and their families. On children's rights, the bill will place duties on Scottish ministers to take appropriate steps to further promote and raise awareness and understanding of children's rights, as set out in the UN Convention on the Rights of the Child, and for ministers and the wider public sector to report every 3 years on what they can in relation to children's rights. The bill will also extend the powers of the Children's Commissioner. On well-being, it will provide a definition of well-being based on Shinari principles. On children's services, local authorities and health boards will need to prepare a children's services plan and report on that. There'll be a duty on health boards and local authorities to provide a named person, and health boards and local authorities will need to ensure a child's plan is created for every child or young person that needs one. So lots to do with limited resources. We can't do it alone. We'll have to work with a whole range of partners, including, importantly, the third sector, children, young people and families. And this slide shows some ways which you can contribute. Thank you for your time, and I hope that wasn't too boring.